Agency, Kapihan, Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on e-media.
Buenos dias, Zamboanga! Welcome po sa PIA Kapihan na Zamboanga sa SM City Minpro, hatid ng Philippine Information Agency, SM City Minpro, MCTV, and eMedia. We are live at PIA Western Mindanao Facebook page and other government agencies' Facebook pages including PRO9 and also Pagadian Media, Isa TV Channel 17, PCH Cable TV, and via cable televisions here in Zamboanga at MCTV and eMedia. Welcome po sa ating mga viewers. This is Kapihan na Zamboanga, and we will discuss important topics that will help you make more informed decisions wherever you are. Let's welcome po muli yung ating mga viewers po, especially our Barangay Information Officers Network sa buong Zamboanga Peninsula na parating nakatutok sa ating program. Ngayon naman po, pag-uusapan natin sa ating episode is about the Mass Drug Administration or Vitamin A Supplementation and OPLAN Goodbye Bulate. Kasama natin dyan yung ating Department of Health here in Region 9. Let's welcome po ang ating Medical Officer 4 or Cluster Head po ng Family Health Unit. We have Dr. Cheryl Sarmiento.
Hi, hello. Good day to everybody. Good day, Ma'am Myra. And thank you to Philippine Information Agency for this opportunity.
Thank you, Doc, and welcome again sa ating program. Like I mentioned po, yung ating pag-uusapan is about Mass Drug Administration. Unahin po muna natin yon. Can you explain po kung ano po itong campaign na ito and why vitamin A supplementation remains an important public health intervention?
Alright, so this July 2026, the Department of Health, together with our local government units, Department of Education, barangay officials, health workers, and community partners will implement the harmonized Mass Drug Administration campaign. So this campaign brings together two important child health interventions, yung OPLAN Goodbye Bulate or mass deworming and vitamin A supplementation. So these interventions are safe, effective, libre po, free of charge, and proven to improve yung health ng ating mga bata, anak, their nutrition, their growth, their learning, and overall development. So, through this campaign, we hope to reach every eligible child in Zamboanga Peninsula and ensure that no child is left behind. So, again, ano po ba yung Mass Drug Administration or MDA? So, isa siyang public health strategy where yung preventive health services ay binibigay natin to large groups of people at the same time to protect them from common diseases and health conditions. So, yun na nga, this July, we'll have vitamin A supplementation and OPLAN Goodbye Bulate. Integrated into one campaign kasi gusto natin i-maximize yung community visit ng ating mga health workers. We want to ensure that children will receive multiple health benefits at one time. So, vitamin A supplementation remains an important public health intervention because it strengthens immunity, yung defense, supports healthy vision, promotes growth and development, and helps reduce severe illness and death among young children. Sa katunayan, nung January to February MRCA, Measles Rubella Supplemental Immunization Activity, we were able to provide vitamin A to more than 427,000 children aged 6 to 59 months. So, etong July, many of these children will already be due for their next round of vitamin A dose.
Okay. Doc, who are the primary beneficiaries po ng vitamin A supplementation and how often po ito binibigay sa ating mga beneficiary or sa children?
Yeah, so ang primary beneficiaries natin ay children aged 6 to 59 months. Children aged 6 to 11 would receive yung blue capsule na vitamin A, and then yung children naman aged 12 to 59 months will receive one red capsule, Yung vitamin A helps strengthen yung, kanina nasabi ko po, yung immunity or yung body's natural defense against infections. And it supports, again, healthy eyesight and promotes normal growth and development and helps children recover better from illnesses. So, parents, they can expect improved protection against common childhood infections and better overall health for their children. Kung meron po kayong anak na 1 year to below 5 years old, every 6 months po ito binibigay. So, ang in-expect natin, ang isang 2-year-old, for example, twice a year siya at dalawang beses sa isang taon siya makatanggap ng vitamin A every year until he becomes 5 years old. Every 6 months ang interval.
Okay. So, yun pala, Doc, no, yung binibigay natin. Pero ngayon po, this is for the whole month of July po natin siya, okay, ibibigay. And how is the DOH will be implementing this, yung ating vitamin A supplementation campaign in communities across the region?
Okay. So, routinely, available naman po itong services sa ating mga health centers. So, it's the DOH working closely with local government units, barangay health workers, community leaders, no? Kasi gusto natin ang vitamin A ay nade-deliver through routine health services sa health centers. Pwede din sa community outreach activities, yung mga purok kalusugan initiatives namin. And during campaign, so yun ang mention namin yung MRC nung January, February. And then this July, we're grabbing this opportunity again since meron pong Mass Drug Administration or yung OPLAN Goodbye Bulate, isasabay na natin din kasi yung majority naman ng bata na binigyan nung January, February, eligible na sila kasi after 6 months na. Okay. So, ganun yung pag-implement ng vitamin A sa ating region, sa ating country.
And health center-based po siya, hindi po siya sa mga schools.
So, since ang target natin ay 6 to 59, hindi pa sila school-age children. So, hindi siya school-based. Community-based pwede siya. Kaya siya sinabay sa OPLAN Goodbye Bulate kasi yun yung campaign na both school-based at community-based. So when the health worker would go to the houses and see that while giving the deworming to eligible, they will also be able to assess children below 5 years old if eligible na sila for vitamin A.
Doc, ano po yung ating mga challenges for this one? Do we have target po ba na high coverage for this campaign?
Yes. So, when it comes to challenges, I think similarly to other health programs that we implement in the region, yung geographically isolated and disadvantaged areas remain to be a challenge. Reaching the eligible there in those areas, transportation difficulties, weather conditions, misinformation, and population mobility. So misinformation, some of them would not like to receive vitamin A or any other health services, no? And then population mobility, they transfer from one area to another. We can't catch them to give them their second dose, for example. Ayan. So, but the DOH would work closely with the LGUs and barangay officials and community workers to ensure na we are able to provide them health education, conduct health education activities, strengthen community mobilization, and implement map-up activities for children who may have been missed sa routine na mga activities nila. So, you were asking about the target. Yeah, target. For vitamin A. For vitamin A, ang sinasabi natin ngayon, since meron na tayong data from the January, February, which is around 427,000 na mga bata, yun yung gusto nating mahanap, balikan, kasi eligible sila for second dose. We want them to complete their second dose.
Thank you, Doc. Doc, how are we going to encourage naman yung participation ng ating ibang parents, no, or guardians, lalong-lalo na siguro yung sa mga bagong panganak na hindi pa nakakuha ng kanilang first ever dose ng ating vitamin A. So how are we going to encourage them para makapag-participate po dito sa ating vitamin A supplementation program?
Yeah, very critical yung role ng ating parents and caregivers, no, pagdating sa utilization ng mga health services. So, what we're saying is this July po, aside from the deworming, yung Department of Health will also provide vitamin A supplementation to eligible children aged 6 to 59 months old. So, we encourage all parents to take advantage of this opportunity kasi yung vitamin A capsule, lagi naman po itong free, at safe ito and proven to help protect children from illness. So, they strengthen yung defense ng ating mga bata, no, and support healthy vision. Again, yung growth and development, inuulit natin. And they help children become more resilient against common childhood illnesses. So, as parents, alam ko we all want our children to grow healthy. maging active and ready to learn. So something as simple as ensuring that your child receives vitamin A at the right time can make a really meaningful difference in their health and future. So for those parents na nakatanggap po ng 6 to 59, so kung meron po kayong natanggap na vitamin A noong January, February, kindly check po again yung health record niya or card niya po and coordinate with your local health workers and participate po sa upcoming activities ng inyong mga barangay or community for the vitamin A supplementation.
Lalong-lalo na libre naman ito, no? They just need to visit lang talaga yung kanilang mga health center para ma-ensure nila yung kalusugan ng kanilang mga anak. Doc, let's proceed with the OPLAN Goodbye Bulate naman kasi ito every July din talaga natin itong campaign na ito. Clarification lang, Doc, both po ba vitamin A supplementation and Goodbye Bulate is tablet po? Oral-based siya?
Si albendazole, which we give during the OPLAN Goodbye Bulate, is tablet, ichuchu niya. But yung sa vitamin A, it's a capsule, pero parang kinakat yung nipple and then drop lang, liquid siya. Yan, yes. Ganon siya. Parang patak din,
So
vitamin
both
A.
oral pa rin?
Yes, both oral.
Eto na po tayo, Doc, no? Sa what is Goodbye Bulate and why is deworming considered pa rin po as a critical component of child health?
So yung OPLAN Goodbye Bulate is the Department of Health's National Deworming Campaign under the Integrated Helminth Control Program. Ang goal niya po, gusto nating i-reduce yung mga intestinal worm infections among children and adolescents through the regular administration of safe and effective deworming medicines. So deworming, considered pa rin siya critical component of child health because it helps protect children from the harmful effects of worm infections before etong infections can lead to more serious health and nutritional problems. So, by conducting regular deworming, which is sa atin po ngayon ay every January and July of the year, we want to help ensure na yung children are healthier, better able to benefit from the food they eat, and better prepared to grow, learn, and participate in school and community activities. Kaya po, yung deworming remains to be one of the most cost-effective public health interventions for children and adolescents. So, maybe a simple way to help us understand is yung deworming helps ensure na yung nutrients na kinakain or kinoconsume ng ating mga anak, they are used for their growth and development at hindi po ginagamit or ninanakaw ng mga worms.
Paano po ba talaga nakaka-affect, Doc, yung intestinal worms po sa health and nutrition ng mga bata?
Yeah. Intestinal worms, they have significant impact sa health ng ating mga anak and their development. When worms live in the intestine, so they compete. Ito na yun. They compete with the child for the nutrients and they interfere with the body's ability to absorb essential vitamins and minerals. So as a result, yung mga anak po natin na may intestinal worms, they experience poor appetite, may anemia or low yung iron levels nila, may malnutrition, may poor weight gain, masakit ang siya, stomach discomfort, fatigue, mahina, or they feel weak, delayed physical growth din. So these are health effects that can also really influence a child's ability to learn. So children who are frequently sick, tired, or undernourished may have difficulty concentrating in school, and they miss classes, more often absent kasi masakit yung tiyan, and may not perform at their full potential po. So if left untreated, yung mga worm infections, they can affect yung overall well-being and in the long run, yung future productivity ng ating mga bata. So that's why very important po that we prevent and we treat worm infections. It's an important investment sa health nila at sa education.
Doc, who should receive naman po yung ating mga deworming treatment under OPLAN Goodbye Bulate? And how often din po ito being administered? Is it same po ba na 6 to 59 months po? Same with the
So ito po, naka-expanded yung target natin. For July 2026, yung MDA natin, the target beneficiaries are school age 1 to 4 years old. Children age 1 to 4 years old. And then yung school age children, 5 to 14 years old. And even adolescents, age 15 to 19 years old. So yes, and for Region 9, we have an approximate target population of 1.2 1.98 million children and adolescents. So medyo marami-rami po ito. Yung mass deworming natin, as mentioned, twice a year din siya kinakandak. Every January and July po. So like round 1 January, round 2 July. So itong approach natin, gusto kasi natin i-reduce yung burden of worm infections before they lead to more serious health and nutritional problems.
So how is DOH po working with schools? Dahil nga counted na dito yung ating mga children age up till an adolescent age, no? Paano po na tayo nakikipag-work with schools, LGUs, and communities natin para ma-implement po yung OPLAN Goodbye Bulate?
Yes, so tama po. Yung success ng OPLAN Goodbye Bulate, it depends on strong partnership. So DOH works closely with DepEd, LGUs, schools, barangays, teachers, barangay health workers, and community leaders. So regularly, or before the implementation of the campaign, we would really meet with the DepEd, concerned LGUs, para mag-prepare sa pag-implement nito. They would do micro-planning, they would do reorientation, and yun yung community dissemination of this information para pagdating po ng July or campaign period ay marami naman po mag-a-avail at mag-utilize ng health services na ito. For school-age children, the worming activities are conducted through the schools in coordination with DepEd. Yung preschool children and out-of-school adolescents, yun yung community-based approach tayo. Through the health centers na ito and the barangay activities or barangay health workers. We also would like to take this opportunity to say na we also promote yung worms strategy, no? Worms, W for wash hands, O for observe proper use of toilets, R, reduce exposure to contaminated food and unsafe environments, M for mass deworming, S for slippers or shoes. Use slippers or shoes kasi deworming, tinatanggal niya po yung worm today, pero yung healthy habits, yun yung nag-help mag-prevent from coming back pa, yung magkaroon ulit ng infestation.
Okay. Doc, how does DOH naman address yung mga common na misconceptions and concerns para and ensure yung public confidence natin dito sa programa ng OPLAN Goodbye Bulate?
So, yung medicines that we use in the program, such as yung medicine, yung albendazole that we'll be using have been safely used worldwide for many years po. And is also recommended by the World Health Organization and the Department of Health. Most children experience no side effects naman po. Yeah, some children may experience mild and temporary reactions, such as yung sumakit yung tiyan, or nausea, nasusuka, nahihilo, headache, or loose stools, or vomiting. But usually, these symptoms would resolve on their own. And some of these symptoms may occur because the medicine is acting on existing worm infections in the body. So, what we can reassure also siguro the public is that yung health workers natin, since they are regularly oriented on the conduct of this campaign, we are also making sure that they are trained to monitor the children and to provide appropriate support. And may referral, if ever, may referral system kung may rare or severe reactions.
Gaya po ba ng vitamin A or mass drug administration natin, meron din tayong target for the OPLAN Goodbye Bulate?
Our goal is to achieve at least 85% coverage among eligible children and adolescents throughout the region. So, families play a very important role in achieving this goal, tulad po ng vitamin A. Kasi first and foremost, gusto natin the parents who have understood the importance of this public health service will allow their children to participate and also keep siguro yung record nila on their utilization of this health service and follow the health advice from their health workers, practice proper hygiene and sanitation, and encourage hand washing. We also want to ensure that yung mga parents inform sila that their children should really wear slippers or shoes kung naglalakad po, and support proper nutrition and vitamin A supplementation. So, through these actions, also families, the community, they become active partners in protecting children from worm infections and malnutrition.
Okay, thank you very much, Doc, no. So we are really expecting na sana ma-achieve natin yung target number natin or target population natin for this OPLAN Goodbye Bulate. And of course, dun din sa ating vitamin A supplementation program. With that, Doc, any message po or reminders naman sa ating mga parents, guardians, caregivers po to support the program of Department of Health, especially this month of July?
Yes, on behalf of the Department of Health, Zamboanga Peninsula Center for Health Development, we thank our partner PIA for helping us bring these important messages to our communities. So vitamin A supplementation and deworming are simple interventions, but their impact is really significant po. So today, they help. Together, we can help ensure that children are healthy, well-nourished, and ready to learn. So they help children stay healthy, grow properly, perform better in school, and reach their full potential. So we encourage all parents, teachers, local leaders, and community members to support the July 2026 Harmonized MDA campaign, the OPLAN Goodbye Bulate and Vitamin A supplementation. Kasi pag sama-sama lang po tayo, we will be able to raise a healthier, stronger, and brighter generation of children in Zamboanga Peninsula. Maraming salamat po at magandang araw.
Thank you so much po, Doc Cheng. Again, maraming salamat po sa Department of Health for giving us this opportunity and to inform nga itong ating mga important po na mga programa from Department of Health dahil again po mahalaga talaga yung kalusugan lalong-lalo na po sa ating mga anak, sa mga bata po. Again, we have Dr. Cheryl Sarmiento, Medical Officer 4 po and Cluster Head of the Family Health Unit ng Department of Health Region 9. Thank you once again, Doc, for being with us this day sa ating programa. And with that, maraming salamat po muli sa lahat po ng ating mga viewers ng PIA Kapihan na Zamboanga sa SM MinPro. Magkikita pa po tayo next week sa ating programa pa po. And of course, we would like to thank the following sponsors. We have Dunkin, Karimadon, Camiseta, all available here at SM City MinPro. Muli, maraming salamat sa ating mga viewers and thank you to the PIA Kapihan team for making this episode possible. Again, hanggang sa susunod po na linggo, magkikita pa po tayo sa ngalan po ng Philippine Information Agency Director General Catherine Chloe De Castro at PIA Region 9 OIC Jocelyn Alvarez. Ito si Myra Espinosa. Muchísimas gracias.
Mas pinadali na ang government transactions sa tulong ng eGovPH Super App. Pwedeng-pwede mo nang magawa ang lahat ng ito. I-download ang eGov app sa iyong smartphone o tablet mula sa App Store o Google Play Store. Pagkatapos, ilagay ang iyong mobile number at i-authenticate gamit ang one-time PIN o OTP para marehistro ang iyong account. Saka ilagay ang iyong mga pangunahing impormasyon at kumpletuhin ang facial recognition technology para sa verifikasyon ng iyong pagkakakilanlan. Para sa mas mabilis at mas maayos na serbisyong panggobyerno, gamitin na ang eGovPH Super App.
Philippine Information Agency, Kapihan na Zamboanga. Sharing with you timely, accurate, and relevant information regarding government programs, projects, and activities. Catch us every Thursday at 4 p.m. on eMedia.